So you speak fluent Korean?
안녕하세요. 네.
Hi, I'm Dr. Bernard Siew, and welcome to another episode of A Bite Angle. And today we have a special guest, Jieun Wrigley, and she will. I would like you to introduce yourself, shall I?
All right. Thanks, Bernie. I am a functional nutritionist, and I am happy to talk about whatever you'd like to talk about related to, oral health, gut health, and have a great conversation.
Sure. Yes. Yeah. So welcome. I guess the first question would be, we want to know a little bit more about your background. Mm-hmm. Where did you do your formative studies? And then we'll go into more about what functional nutrition is.
Yeah. Oh, great. Well, I like to always say that I'm an unintentional nutritionist.
Right.
So I don't know if you have kids or not, but when I had kids, it was a huge learning experience, and it was the biggest wake-up call. So for me, I started this journey not because as a kid I wanted to be a nutritionist. I actually have, my background is in finance and in journalism. But when I became a mother, I quickly realized that the conventional medical system treated my kids in a very symptomatic way. So my son, when he was born, he just moved from breastfeeding to formula. Didn't realize that iron content in formula varies across brands. So, just thought, okay, I'm going to buy the most expensive one. This is going to be the best. This ended up giving him constipation.
Oh, right.
So I have this, kind of 3-4 month year old, and I took him to the pediatrician. The pediatrician says, oh, he's been constipated for 3 days. It's fine. Don't worry.
Yeah, right.
9 days is usually when I step in. And I'm thinking 9 days of constipation. So for me, when I took him to the pediatrician and I didn't get a solution, I then thought, okay, how am I impacting my child? So realized it was the formula. Then later, my daughter, when she was born and she was about 1.5, we had chronic ear infections, chronic runny nose. She was 1 week on, 1 week, off, 1 week on. So took her to ENTs, and they said, oh, she's got this really bad infection. We need to operate. We need to remove her adenoids. We need to remove her tonsils. We need to stick in a grommet. And so overwhelming.
Sorry, and where was this? Was it in Singapore?
No, this was in Dubai.
Dubai.
Yeah,
okay.
We used to live in Dubai. So she was around 1.5, 2 years old. So for me, when I received that news from the doctors, and I thought, this seems kind of, overwhelming, and it seems too much. And then nobody asked me, what are you feeding her, or what's her environment like? She's at home. She's less than 2 years old. So it didn't make sense to me. So then I found a practitioner who said, hey, let's look at food. Let's look at inflammation. And I went down that track, and that really got me hooked. And I thought, wow, food is medicine. Food is power. Food can be poison.
Yes.
And from that experience, I then thought, I'm going to become my own doctor.
Yes.
I'm going to treat my own kids.
Deep dive.
Yeah, exactly. So then I went and did all the pre-med courses. I retrained, and then I thought I'm going to go to med school. But then I realized, okay, well, actually, in med school they don't teach nutrition. No. And what's worked for my kids has been changing their diet. So that's why I changed, and I went and got my master's in nutrition from Tufts University.
Right. Okay.
And I'm getting my doctorate right now.
Right. So where did you grow up? Or was it in the US?
Yeah.
Okay.
I'm Korean American. Grew up between Los Angeles and Seoul.
Oh, right. Okay. So as in it was Seoul first and then the US, or it was the
US
other way
first
around?
and then yes. Yeah.
Oh, wow. Okay. Yes.
Kind of back and forth.
Yeah. So you speak fluent Korean?
안녕하세요.
Oh, wonderful. Yes.
Yeah.
So now you've been in Singapore for some time.
Yep. A couple of years.
Same thing with us. Actually, my wife and I have been in Singapore for 25 years, so quite a long time. But why I actually asked about the where you were at when you had your kids also is that, and I had a professor in my university. And interestingly enough, in dentistry, I don't know so much about the medical society, but in dentistry, we had this one policy maker professor who used to talk to me about community dentistry. And he said, if you look and be observant enough, you'll be able to see where they grew up just by looking at what has been done to their teeth.
Oh, interesting.
And it's interesting that what has been done to their teeth is based on the policies that the country and the government has made. And then you can also see the generational impacts that happen because of the intervention, or sometimes the problem of intervention. So like what you said about symptomatic treatment, we are looking at systems where, like in medicine now, you have people like Peter Attia, I think you might be familiar with him.
Yeah.
And they're looking at medicine 3.0, where you do prevention. Like the same thing with the doctor that said, oh, we'll wait until 9 days before we consider it a problem.
Yep.
But why do you wait for, something to be so bad that you have to have then very severe intervention as well, right?
Yeah, exactly.
And it's just watching the trajectory of what's happening. And same thing in dentistry. So I used to be, and still am the, like more a reconstructive dentist.
Okay.
So we were taught to wait for things to get really bad.
Right.
And then treat it.
Yeah.
And we know that treatment is like this, we'll have a to-do list, but we have to wait for the problems to occur to a certain point. And then we will do no harm.
Yeah.
But the interesting thing is that the prevention is the most important part of it, so that they never get there.
Yeah, exactly.
Right?
Yeah.
So we are now seeing that and this is what brought me to the nutrition path, because we saw that a lot of our patients had breakdown in the mouths. That takes years.
Yeah.
So mathematically, what I tried to work out is that, okay, so there are a couple of very good researchers that did these quantification studies to show that your tooth breaks down usually at this regular rate. So if, let's say you break down 100 microns of enamel structure every 10 years, so you lose 1 millimeter in 100 years. But why is it that we're seeing people that are breaking down teeth that is about 2.5 millimeters in 50 years? So we would look at a patient that comes in at the age of 50, and I'll take pictures of their teeth and put it up and say, you've lost 2 millimeters of your teeth, but they won't understand what 2 millimeters is. So I'll just say, arbitrary age, this is 200 years of wear. And they'll go, what? Like, why is it that, this particular tooth is worn down this much? And then we just realized that actually it's not sugar that causes a lot of damage. So in an affluent, well-educated society, why is it that we're seeing as much disease, if not more, sometimes? Like in the US, dentistry is worse now than it is 20, 30 years ago. And it's because of the incentivization of treatment as well. Right?
Absolutely. Yeah, I think you've raised so many points, and so we could have so many layers. I mean, but first you mentioned just looking at the mouth and the teeth, you can see where someone comes from.
Exactly.
But I think that goes back to the idea, and with functional practice, it's about looking at the person as a whole. So when you look at their mouth, you could actually probably see, people who might be trending towards heart disease, diabetes. You can also see, have someone's diet.
Absolutely.
So I think the mouth and, the oral microbiome is such a great predictor. Like you said, it's years in advance.
Yes.
But it's just about having a practitioner who can recognize that. So I think that's really a really key point. And I think it's great because, in dentistry, you have this sort of built-in twice a year annual checkups. And this is where if dentists could spot these things a little bit earlier, I think that, and say, hey, there's a bit of gum recession going on, or, we have a couple of cavities, and not just treat the cavity, but think, hey, let's go into your diet. Let's go into your immune system. Let's talk a little bit about this. This could be incredibly preventative.
For sure. Yes.
But then to your point, in the US, I think dentistry, you said it's, change track a bit. And I think from the functional lens, dentistry is very helpful, but equally it can also be a trigger or a mediator of poor health. Sometimes you put in, amalgams, or you put in, you've got retainers, maybe they're BPA laden, or they have BPS or something.
Yes, right.
Or you get a night guard, or you have, just the toothpaste you're using.
Yes.
All of these things could potentially disrupt the microbiome.
Yes.
And the balance. And whenever we have an imbalance, and we have an imbalance for a long time, that becomes chronic inflammation.
Yes.
So I think I love the idea of maybe dentists having a little bit more scope, just besides treating the mouth, and really using it kind of holistically as saying, hey, let's start. This could be a starting point in conversations about your broader health.
Yes, and for sure. And actually, I've learned a lot from my patients. So why I'm where I am right now as far as knowledge and wisdom is concerned is based on debates that I've had with my patients.
Oh.
So I had one patient that was very anti-fluoride. And I don't know where you stand on fluoride. Actually, where do you stand on fluoride?
Generally, I think it's a little bit too harsh. But again, I'm not a dentist. But in terms
that's okay.
of disruption of the microbiome,
For sure.
I think there might be more gentler ways to help prevent decay.
Yes.
And more root cause. But fluoride is a very symptomatic treatment.
Yes, yeah. And so going back to fluoride, I went through my training with very doctrinated versions of what fluoride is. And then also we were explained to that fluoride is pretty much as great an invention as sliced bread, right? So, and it's not to be questioned to some degree. But very interestingly enough, we did 5 years of dentistry training, and part of it's also general medicine. And one of our professors made us do a debate. We would have an actual public debate. And one side of the class would be chosen to debate against fluoride, and one side would choose to debate for fluoride. And then at the end of it, just think for ourselves. But interestingly enough, there's so much more journal publications that is for the advantage of fluoride.
Yes. Yeah.
Yeah. And actually, very famously, I know this guy through emails, but he was a professor in the US, and he used to be he was almost like the grandfather of fluoride policy. And very recently, he actually went against fluoride.
Right.
And he lost his tenure from his professorship doing it.
Right.
Yeah. And so there's politics involved as well. But also I think people are not sure, like the public don't quite understand the benefits of fluoride, but also what can be harmful. So one of my patients, going back to that story, is that he came to me and said, fluoride's terrible. It's the worst thing ever. And I said, maybe you're going a little too far. And he goes, have you not heard about this problem? And in the US, you're seeing that there are all these issues with fluoride, people having kidney disease because of fluoride, but there are confounding and co-founding factors. And so then I said, okay, that sounds a little far-fetched, but I promise you we'll go back. I'll go back to my studying of the data, and then we'll come back to it. And quite soon after, I read actually about 200 journal articles about fluoride, and I changed my mind about fluoride as well. So, but it's more nuanced.
Yes.
So one thing is that why would I give fluoride to someone who doesn't have any decay problems? One.
Yeah.
Second thing is that it shouldn't be in water.
Yeah.
Because the access to fluoride has changed now compared to in the 70s.
Yes.
Where there's more toothpaste with fluoride.
Yes.
So are we now over fluoridating, right?
Yeah, exactly.
And so if we look at all those factors, and then what this professor that lost his tenure happened was that he just tracked after 30 years what benefits have we had from fluoride? Are we seeing way less dental disease? And in the US, absolutely not.
Right.
So then he goes, well, we are then, it's almost like saying, let's give everybody antibiotics just in case that they will get unwell.
Yeah. No, I think it's a great example. I think fluoride, like you said, it's very nuanced. It could be person specific, and it's very effective, right?
Yes.
And it's like modern medicine is. It's very effective at what it's meant to do. But it's just the longer term, when you look at longer term health.
Yes.
That's where the question is it really, really beneficial, or is it just spot treatment?
Exactly.
So,
yes,
but in sort of the functional practice, you look at sort of enamel damage or decay, and you actually see, I think there was a study that they said, people who have celiac disease, it's 1 in 5 have enamel damage. So you can sometimes think, okay, well, hey, let's talk about your diet. Do you know whether or not you're gluten, sensitive, allergic? Maybe that's something that, if you did the fluoride treatment, let's say, but you wanted to go and say, hey, let's look at the root cause of why you're having damage.
Yes.
And it's not just sugar. It could be something else that's food related. Oh,
absolutely. Yes. Yeah. And going back to the celiac, it's now very much theorized because we can never be sure. But the evidence from the teeth, and if you do enough detective work, so teeth develop from the base upwards, the tip, and then it comes down, right? And so we can, like the barks of a tree, if a tree actually had certain trauma at a certain time, we can actually see the damage in the barks of the tree. So when we look at teeth, we can actually just backtrack. Again, like a detective, I can see a child at the age of 9 and go, did you have traumatic birth for this child? And the mother will go, how do you know?
Oh, fascinating.
Because I said these 2 teeth are affected, and it's for maybe about a 2-week period, and we don't see any damage anywhere else in the mouth, but just these 2 teeth. And these 2 teeth are usually the ones that develop when they are at birth, at the time of birth. Right? So sometimes it's like jaundice or like a serious illness, but we see that happens. But actually, if you ask a dentist that is not so observant, they would just say, oh, I think it's fluorosis. It's like if it's fluorosis and they were exposed to it over periods of a long time, you're going to have the mottling effect throughout the teeth, not just one tip of the tooth, right? So then it's just like you said, with nutrition, it's anything that's functional and holistic. You just have to look at the whole person. I think diet's so important.
I think people forget that the mouth it's a microbiome, just like we have a gut microbiome. There's a vaginal microbiome. The mouth, the oral microbiome is also, and I'm sure you know this better than I do, but it's not just one general microbiome. It's like the cheek is different to the tongue, is different to, and so it's like these little microbiomes that are right next to each other. And they're very different, and they're synergistic, and there's commensal bacteria, there's pathogens.
Absolutely.
So it's this whole living ecosystem. And I think a lot of times people forget that, oftentimes we just eat, we don't think about it, we don't think about what we're putting in our mouth, and we don't think about the microbiome either. And that's exactly my point as well. So I think we'll speak about inflammation in a moment, but I speak to my patients about their diet a lot. Great.
And they go, I eat pretty healthily. I'm saying, oh, no, actually, I don't really care so much about, not necessarily that it's healthy or unhealthy. So you can take the same amount of sugar, but some people will have the damage and some people don't. And it depends on their other habits as well, right? So like if you get your sugar from liquids, it's way worse than you get it from a food. Like from a cake versus a soda drink. And I explain why too, because the combination of citric acid as well will cause the acidity change. And I explain it as such is that we find that in the mouth, the breakdown happens when you have a supercharged substrate that helps one particular type of bacteria. So in the mouth is the strep mutans.
Yes.
So they are the ones that produce the most amount of lactic acid. So I said basically decay is not by germs chewing away at your teeth. It's actually they're pooing on your tooth. And they're going, what? No.
Yes. Yeah.
So yeah, it's just the waste. And so if you get more gangsters in a community and it reaches a certain tipping point, then they take over. And then the whole place is actually a crime scene, right? So what you want to do is have the good bacteria thrive in a very balanced environment, and you don't even have to worry about the bad bacteria. Yeah, so I'm guessing that's kind of the same.
We're speaking the same language here.
Yes,
because with the gut microbiome, a lot of times I use this gangster analogy as well. I think it works and people like it. You know, you have your commensal bacteria or good bacteria, and you have your bad pathogenic bacteria, like the gangsters.
Yes.
And it's these tantrums or the waste products, like you said.
That's right. Yes.
And I always tell people, you can't just get rid of these gangsters. You can't just take antibiotics and blow them away. So you have to recognize that they're there. They're part of this ecosystem. You know, we don't know why. You know, things like E. coli, we only see them as a really bad bacteria that can cause sepsis and all these things. But we have to think, well, why do we have E. coli in the first place? Maybe their job is to keep a number of other bad bacteria at bay. We're not sure yet. So maybe you've got one bad gangster, but he keeps all the
like
little
a vigilante.
guys. Exactly. So the thing is, I think people have to realize is that it's not just that they're there, it's whether they're active or inactive. And that really matters.
Yes.
And quantity also, you know, because if you start to get too many gangsters, then the ratios are off.
Right. Yes.
But it's the idea that you can't just blast them out. And I really like that you talked about it's the waste product. So same thing with food. A lot of times people say, okay, well, I'm eating this thing and I think it's healthy. And I said, okay, well, it's not just about, you know, the calories here or let's say the acidity, you know, of the food on your plate. It's actually when you metabolize it and it's the byproducts that are being made. That's really important. So if you think about, let's say, animal protein versus plant fiber.
Yes.
Animal protein, when you consume it, there's all these wonderful amino acids, all these wonderful things. But the byproduct you have to recognize is going to be an ammonia-based product. You know, and ammonia, when it combines with our carbon dioxide in our body, it creates a very acidic product. This then has to be metabolized by the kidney. So that you have to, when you think about animal protein, you have to think about the whole cycle. So same thing with plant fiber. You think, okay, this plant fiber, I'm going to consume it. And when it gets metabolized, the byproduct are these short chain fatty acids. These are really important and really positive signals that don't burden our system, but actually support our immune system. So when people are choosing, oh, do I have the steak versus my vegetables? I try to remind people, you've got to think about the, not the waste product, but the end product that's in your body being metabolized. Just as much as the taste is important, it's what are you ending up with?
Yes. So let this be the segue to, we can talk about inflammation as well.
Yes, yeah.
But from my understanding is that we see the acidification of our system being the one, almost the sole reason for inflammation to occur. Is that in your studies kind of the right thing to say? It's obviously more nuanced than that, but it's the one thing that we look into. Yeah,
no, I think you're right. You know, the blood is managed in such a narrow pH, and when we move out of that, that's when, you know, we have sort of, you know, not to get too technical, like, you know, enzymes start to denature. And so we want to make sure that our blood is always in this specific range. And when we have, and obviously our blood flow, especially with the gums and the teeth, and when those things go off, then you are prone to having other, you know, microbes that survive better in a more acidic environment versus a more alkaline environment. So, you know, I think that's also one of the underpinning sort of causes of inflammation, is that the food that we eat or the environmental toxins that we're exposed to are changing that very narrow pH that our body has to maintain.
Yeah, so then the body has to work extra hard to get to reverse the inflammation.
Yeah, exactly.
And the acidity.
And fighting inflammation is very biochemical. It's very enzymatic. When we talk about glutathione as a master antioxidant in our system, it's part of liver detoxification. It's also really important in oral health as well. I think some of the studies that are out there show that people with mercury amalgams, so glutathione is needed to bind to mercury, and when it binds, it's not that it goes through the digestive system and then just excretes mercury and we save the glutathione. It actually binds together, and then we lose both that mercury and the glutathione, but then we have to regenerate glutathione.
Right.
So that again takes that energy, and it takes if you got a lot of inflammation going on and a lot of toxins or heavy metals load, and you're constantly losing this glutathione, you have to work extra hard to produce more of this antioxidant. And then on top of that, you have a diet that might not be very rich in antioxidants. Then you're almost creating doubly more work. And you're not giving your body the resources that are needed.
So in some ways that, let's assume someone has more mercury in their system than another person, that person A has more mercury intake than person B. So person A could perhaps counteract that by taking much more antioxidants.
Yeah.
Is that
Yeah,
Is that kind of the right
exactly.
thing to look at it?
I think exposure to inflammation is not just that it's we've been exposed at the same time.
Yes.
It's just everyone has their own immune resilience, and the higher immunity you have, the better you can fight off most of these pathogens or inflammation. But
Yes.
not everyone is at that level.
Yes.
So
yes. And normal is also something that is nuanced as well, right?
Exactly.
So going back to the mercury, this is quite another very debatable topic. What we found is that the mercury that is most dangerous. So you've got organic and inorganic mercury. The interesting thing is that we found that from a scientific basis, the most dangerous part about mercury is the organic form of mercury that can go through the blood-brain barrier.
Yeah.
And that is not the form of mercury that's in the amalgams.
Okay.
And also amalgams tend to have a different level of mercury in different parts of the world and in different concoctions as well. And we found that people who take seafood from the sea, basically tuna, you get way more mercury from that than any metal fillings in your mouth.
Okay, I'm relieved that you say that because I'm a child of the 80s.
Right.
I think I probably have a mercury amalgam, and and recently I'm thinking, oh gosh, maybe I need to change those and remove those. But then the new replacement is these composites. Resins.
Yes.
And the composite resins, maybe again, I'd love to hear more about kind of BPA or sort of endocrine disruption, because again, these are resins that again with saliva and the more acidic your saliva gets, the restoration of these tools become, I guess they wear and tear a lot faster, right?
Yes.
So then I thought, okay, well maybe the mercury amalgam actually it's inorganic. It's not as as vulnerable to saliva changes. So
exactly.
Yeah.
So we it's a very good question that you've brought up, because I think a lot of our audience would want to consider this. The conversation I have with my patients would be that if they come in and they say, look, I've got metal fillings and someone's told me that I need to change them all or else I will have an early death, basically, right? Yeah. And then I said, well, that's a little bit too strong.
Okay.
Because one is that the metal filling that you have, especially if it's just one or two teeth and it's very, very shallow, then what we look at is volume versus what does it do harm to you. If let's say someone came in and they've had a lot of health issues and they've looked under every rock and they've sorted that out, but this one last thing, and they ask me, can you replace them? And is it, and how can we do it safely? I would say I won't even question it. I'll
Yeah.
just go, okay, if this is what you want to do, we will do it in the most safe manner.
Yes. Yeah.
If they come to me and say, what do you think, doc? Do I remove it because of the metal? I said, I'm not sure, because the science doesn't really prove it one way or the other. But it's a good point that you brought up with composite resins as well. Again, not all composite resins are exactly the same. So some are more filled with resin, and depends on what kind of resin they are. But the more modern ones have actually sorted out the bis GMA problems, right?
Oh, okay.
So it's like a BPA basically, but it's like a distant cousin of BPA.
Yes.
So it doesn't quite cause the same problems, but we know for sure that let's say you've got a very deep filling, and there's metal very close to the nerve.
Yeah.
For whatever reason, the mercury in the amalgam, we theorize, is that it actually calms the nerve down.
Okay.
So sometimes if you replace it, we have to say to the patient, you might have inflammation in the nerve, and if it's bad enough, the nerve might die.
Right.
Right. So then you're going down this path that you didn't need to go down.
Yes. Yeah.
But at the same time, if the metal filling is there, imagine metal is very different to our natural tooth structure. So the biggest concern I have with metal fillings is that they seem to accelerate the risk of you fracturing your tooth. Yeah. So if there are other mitigating factors, or if there are other contributing factors that will cause cracking your teeth, like if you're a very severe grinder, and you have a very large filling on the very back tooth, I would say it's better that we replace it. And we can either use ceramic, so we minimize the exposure of the composite resin.
Yeah.
Or if you're financially constrained, then we can use composite resin. So basically it's just what works best for you, but we don't want you to be worse off. Or if we're going to be worse off, we know where the problem is going to be coming from.
Yeah.
And then the patient makes the decision. The only problem we sometimes have with all these nuances is that patients get paralyzed.
Yes. Yes.
Right. I'm sure you get this too, right?
Yeah.
And
Just
they
there's
go,
so many options, and you're like, I'm not sure which one.
Yes. And you need a certain level of we call it dental intelligence to actually be able to make these choices. And to be honest with you, actually some dental professionals themselves don't know how to have this train of thought.
Yeah.
And I've actually tried using AI. I don't know whether you do much work with so I recently got ChatGPT Plus.
Oh, okay.
Just so I could test how I could use ChatGPT to explain back to myself when I know all this nuance.
Yes.
And I type in, what do you think about mercury in fillings? But they'll give me these generic answers because all these answers are out there and they're searching, right?
Yes,
so,
exactly.
Although AI is very smart, it is not wise. So it cannot decide, except that if 100 people said this and one person said the opposite, they will ignore the one person.
Yes. Yeah.
Right? And so you then reinforce a false truth, really.
Yeah.
And so in these kind of things, I think in the future, when it comes to what dentistry looks like or medicine looks like, it's very dangerous because it can go one way or the other.
Yes.
So you have people that would be smart enough to know the difference, and they will seek people like you and me to perhaps then just get the answers that they need.
Yeah. Yeah.
And usually I'll say to them, sometimes it's better not to do anything until you are absolutely sure that that you have weighed up all the risk.
Yes.
But how do you weigh the risk?
Yeah,
And that's the other thing as well.
Yeah, no, I think that GPT is really helpful for clients who come in. I get people who come and say, I run this on GPT.
Yes.
What do I do? Is it correct? And you're right. It's good at searching,
Yes.
but the nuance and applying it to the individual and understanding their context, That's where I think the human helps. But it's great as a decision-making tool because it simplifies for people.
Yes, yes.
What are my options? What are the pros and cons? And then you can have a better discussion. So, yeah.
Yeah. So I'm curious with your work as a nutritionist, how do people find you? I mean, is it that doctors know about you and they refer to you for very specific issues that they have with their care for the patient, and this becomes an adjunct?
Normally I mostly word of mouth referrals from dentists or cardiologists or ENTs or other doctors. And I try to position myself as part of the collaborative care team because, I can help. Really, what I do mostly with people is help change their normal dietary habits. They might think they're doing something healthy, but they don't know why. Or they are trying to make some changes and they just need a little bit of the science behind it explained in a kind of a digestible way to make these kind of daily habit changes. So normally word of mouth, and then we go through sort of an education process. I don't prescribe anything. I don't sell anything. I ask that please come with data, come with the information you had from your dentist or your cardiologist, and let's discuss that within the framework of nutrition. So at the moment I'm terrible at social media. So it's mostly it's mostly word of mouth though. Yes.
Right. Okay. Yes. And I think that is often the best kind of referral. Anyway.
Yeah, I agree.
The difficult thing that I find with such preventative measures is that usually the best results are the ones that go unnoticed, right? So how do you quantify your successes with your clients?
Well, good question. Well, unlike dentistry, where people know that they have to go see their dentist twice a year annually for the checkups, I'm actually the last person people want to see. Nobody really wants to see a nutritionist. And normally people have gone and they've seen another, their GP for sure. They've seen then another specialist, maybe an endocrinologist, or they've had a scope done, or they've seen their cardiologist. So they've gone through all the other specialists and still something's not working, or it's not, or maybe they were fine for 3 months, but they're feeling side effects from their medication or something. So normally I'm towards the end and people think I've tried everything else, but I'm still not where I want to be. So that's where I like to say I generally work with people that are, I guess, more complex case, and not complex in the sense that they're cancer patients or they're autoimmune patients, and I do work with those sorts of clients, but they're complex in that their lives are also complex.
Right.
So it's kind of unwrapping different levels of the person and looking at the person individually.
Yes.
But I think. So unlike dentistry, the idea that I have to see my dentist, it doesn't exist with nutrition. I hope that eventually it will.
Yes.
It'd be great if I could have twice a year, annually, a checkup, check in with a nutritionist to see that you're on track.
So what happens with your clients? So
yes. Okay. So back to your question. So normally I'm seeing complex cases, and they're coming in. Whether it could be someone who's diabetic, someone with hypertension, high cholesterol, someone with, they had a liver, fatty liver disease or metabolic syndrome or something. And what we normally do is look at biomarkers, because that's kind of like, I can't change those biomarkers. Those biomarkers will reflect themselves. So I normally have a baseline, and then we work together, and then after some time we retest. And so for me, those biomarkers and changing those biomarkers is the way I know that this person internally is getting back to homeostasis, back to balance. Or you can see it in, in weight loss patients. I have clients who come in not for weight loss, but, they came in because they had high cholesterol and high blood pressure. And guess what? That's because they have a lot of visceral fat. And then, we worked together, and after a month, I've got one gentleman I'm working with right now, and he's lost 9 centimeters.
9 centimeters?
Centimeters.
Wow.
In 4 weeks. I mean, credit to him. He's been
4 weeks.
super disciplined.
Right.
And we've been working on a daily basis, and he gets it. He's implementing.
Tell me what he did.
So this is where I don't give diet advice without looking at your labs, because then it's not personalized.
Sure.
So,
yes.
but for him, I mean, he had a lot more inflammation or visceral fat to get rid of. So you might not ever need to lose 9, but for him that was this.
Yes,
so from his baseline, he's dropped 9. He still has some ways to go.
Right.
But I think it's just about finding different objective markers, because a lot of times people say, I feel great, I feel good, and I say that's good and that's important.
Yes.
But I also want objective markers that I can see
exactly.
and saying, 6 months ago when we started to today, this is improved. So that's generally how I can see, kind of track my successes.
And so do you order those biomarkers? Like, it's through a blood test, is that right?
It's through a blood test, yes. But this is where I'm part of a collaborative care team, and I need to work with a GP or a cardiologist or someone, and they can run these.
So in your practice, do you have a GP that is with you within the practice itself, or it's
for me,
adjacent?
It's whoever people can come in with their own GPs, whoever they're most comfortable with.
Yes.
I don't mind. I do have a couple of GPs who I work regularly with, but for me, it doesn't really matter. It's really just about the lab data that I can see and have a look at and understand, and help people understand that data within the broader context.
Yes.
Because I mean, sometimes you go to some GPs and patients will say, oh, they saw me for 5 minutes.
Yes.
And that's it.
Yeah.
You're like, well, how can you have a conversation in 5 minutes?
No, you don't.
Can't.
Yeah.
So with me, we go a lot, we go in depth, we go, a bit broader and deeper.
Yes.
So
Yeah. So people see me, and I guess this is a personal thing. So just going through with you here, is that I have inflammation issues.
Okay.
Right. So people look at me and go, well, you don't look like you've got inflammation issues, but very high familial risk for cardiovascular disease. And I'm already showing signs at a younger age.
Okay.
And I think a lot of it's stress related. So that's what my cardiologist tells me. Right. So, and it's high cholesterol as well. And so when I tell some of my patients, because oftentimes they would feel like I'm judging them or something's happening. When I ask a lot of probing questions, and they go, I don't think I need to tell you that.
Yeah.
Because I will say, what medications are you on? And go, oh, nothing really. Then say, then they will say things like, I don't think it's related to dental. I'm like, you have to tell me everything.
Yes.
Right.
Yes.
And they will say, oh, yes, I've been taking this cholesterol, but yeah, it's nothing to do with you. I'm like, yes, it is. Right. So then I said, okay, how many cholesterol medications are you on? That's the other question as well. And they would go, oh, 2. And I said, well, okay, that makes sense. Blood pressure. And some would say, no, my blood pressure is fine. Others would say it's high. And then my next question would be, how well are you sleeping? Because oftentimes they're all very interrelated.
Yes. Yeah.
Right. And also how well they're breathing. So usually we can tell, my wife thinks it's an uncanny skill, but I will see a child and I'll go, oh, that person's a mouth breather. Or that one won't be sleeping very well. And that one's going to have decay problems. She goes, how do you know? I said, just by looking at the structure of the face, we can tell. And going back to me is that I do a lot of exercise. And interesting thing is that my gut tends to be very sensitive.
Okay.
And there are some things that I take that will really trigger it off. Like I feel like I'm lactose intolerant now. But it's very specific things. So I can have cheese, but not milk. Right? And so...
Well, you probably can't have both, but okay.
Yes, probably can't have both, but perhaps... but milk is a real trigger, right? Yeah. So... And I think it's also the way the milk is processed, apparently, the lactose itself. So in all those factors, I think I would probably be a client of yours.
Yes, yeah. Well,
in this kind of situations, right?
Happy to help. Yeah, a lot of times I see people who have familial history or they have something, and they're not really sure because they're like, I exercise well. When you look at me, I might not look like I have inflammation. But again, inflammation appears for everyone in different ways.
Yeah, in different ways. That's right.
You know, I like to say, you know, everyone has a unique fingerprint.
Yes.
Their microbiome is actually just as unique as their fingerprint. So your fingerprint is different than your wife's or your child's or your parents'. It's your own. And so is your microbiome.
Yeah.
So you have to sort of respect that.
Yes.
But yes, the dairy is a very common inflammatory trigger, and a lot of times people say milk is fine. You know, cheese is fine, but not milk. And you have to think it's not usually the lactose.
No, it's not the lactose.
Because the lactose is the sugar. It's actually probably the casein, which is a protein in dairy, or the whey, that's a protein in the dairy, and we react to those.
That's right.
And it's hard because, you know, if you go by how you feel, some days your immune system's high. And I like to say, you know, when you're eating food, we never eat in food just in isolation. We eat them in combination. So it's very hard to pinpoint exactly what is causing that trigger. But inflammation is more like a bucket. It's like you eat a little bit of cheese here, and then, you know, you have a lot of vegetables, so then your inflammation drops, and then kind of it's always moving.
Yes.
But then let's say you have a couple of days where you've just had too much, and then it hits that threshold, then it tips over, then you have a really bad symptom. Then a lot of times people pinpoint it to that last thing they ate, but really it was actually the days before. It's the buildup. So this is where blood testing is really helpful, because by looking at you, I wouldn't necessarily say, oh, you've got inflammation. But when you test your blood, you know, you see
the markers.
The markers, you see kind of objectively this evidence. And with the food testing, you're either looking for an IgE for an allergy or an IgG. So these immunoglobulins that are there, and we can test for them, and they give a lot of detail.
That's interesting.
But a lot of people don't think that they need to do that.
Yes.
This is where I do recommend people to get data that's relevant to you, especially to food. So you just have more knowledge. You have more information.
Yes.
When you have more information, you can make better choices. So
what are the basic biomarkers do you look for?
Okay. Well, generally I'll say, you know, give me as much data as possible, actually. You know, if you have your standard blood panel, you've got your liver panel, your thyroid, you have your lipid panels, you know, bone health, all of those things are very helpful.
Yes.
In addition to that, probably in relation to dentistry, vitamin D levels is also really helpful. If you have any microbiome data, that would be great too.
Yes.
But also this food sensitivity is also extremely helpful in personalizing sort of dietary strategies.
Right. Okay. Yes. So that's good to know. And then, like you were saying, ideally, you would probably want to see your clients periodically over time, just to see how they're going.
Yeah, periodically. But I try not. For me, I want people to come in. I want them to see me. I want them to understand their data, take it away, and practice it.
Yes.
So
pretty much teaching a person to fish instead of giving them a fish.
Exactly,
right?
exactly.
Confucius.
I like to say, yes. That's a better analogy. I've been using this idea that I like to explain that learning nutrition, or I say talking nutrition, is like learning a new language. So in the beginning, you'll need a tutor to help teach you just the basic grammar, you know, the consonants, the vowels, or whatever the structure is.
Yes.
You have to go and practice that.
Yes.
Then come and check in back with me a little bit later once you've practiced.
Yes.
But the idea is that, I want to teach someone how to fish and not just give them the fish every day.
Yes.
So yes, that's
and same thing with me. So the most basic thing, I think us as dentists as a whole have forgotten this. You would be so surprised. Like I'll get patients that have seen dentists in the past, and when they come to see me, I go, okay, so what kind of toothbrush do you use? And they go, well, I don't know. It's is it an electric or a manual one? Okay, electric. And they go, what type? And most of the time they don't know. And then I go, okay, what toothpaste are you using? And I go, I don't know. Anything that's off the shelf on discount, right? So I said, okay, do you know the fluoride content on it? And most of them don't. And they don't even know what the safe contents are like. So I've actually started to write things in a website that I've created just so that One of the articles is called "Understand Your Remineralizing Agents."
Oh, okay.
So that's a mouthful to begin with. But what are the alternatives to fluoride? So going back to the fluoride thing, fluoride's safe. So I say fluoride's safe within a certain window.
Yeah.
But what if you don't want to just have something that is safe within a window, that is just safe, right? So in dentistry now, thank goodness for some pharmaceutical companies that have started to look at safer ways to have materials that will go in our mouth, because we forget that anything that's in the mouth is a consumable item.
Correct. Yeah.
Right? So although you are initially taught to spit out toothpaste and to then rinse out the mouth, you have to realize that there's like with foods, with ultra processed foods, you're going to have a lot of additives in the toothpaste.
Yeah.
And some of them are very beneficial. Some of them are just there to make the paste in its form by itself. And there's others that could potentially be harmful. So giving you an idea is that a lot of generic toothpaste companies use SLS, sodium lauryl sulfate.
Yes. Yeah.
And it's a detergent agent, right? Why would you need a detergent agent in the mouth? I don't know, because it's not like you need to absorb oils.
Yes. Yeah.
And it's very harmful to the tissues in the mouth, more so for some people than others. And I've gone to toothpaste companies and asked, why do you still have SLS, knowing that we've given you this feedback about how toothpaste, and they go, well, our patients like frothy toothpastes.
So it's for the froth.
It's for the froth.
Interesting.
Right? It's like, but it's not useful. And they go, well, our patients think that it's clean because it's frothy.
Froth. Ah.
And it's like, why not change that thought process, right? So it's the same thing. I have patients that equate mint and fluoride. So one patient came in and it was a toothpaste that was a different flavor. And they go, ooh, this doesn't have enough fluoride. I don't think it has fluoride. I said, well, what do you mean? It's got fluoride in it. But it tastes different. I said, you mean the flavor? The flavor is completely to mask the fluoride, right?
Exactly.
Yeah. So it's all those nuances. But going back to educating the patient, and I'll say, especially when I look in their mouth and they say, I'm brushing my teeth twice a day, sometimes 3 times a day, and
they're using the wrong toothpaste.
Maybe the wrong toothpaste, or the technique is wrong, or something, but the general result is not good, right?
I'm super curious as to which toothpaste. I'm going to have to go onto your website and check it out.
Yeah. So I love this one particular toothpaste, and it's a German-made one, and they only have one toothpaste. So they only make this one type of toothpaste, which is, I spoke to the researcher that created it, and it's actually a cosmetics company that created it. And I think it was because it was a private company and it's like a family-owned company, they could basically do whatever they wanted, right? And I spoke to the managing director of the company, and he said he had a friend who was a dentist and said, there's this new agent, hydroxyapatite. So basically it's enamel structure in toothpaste form.
Yes.
So he goes, I wish there was more access to this type of toothpaste. And the guy goes, well, maybe we can start developing our own. And so he did. So it took them 10 years. And the thing is, I
think I've heard of this toothpaste. Is it because like there was bone density issues in astronauts as well?
Yes,
and so when they come back,
that's where. So that's how it was discovered.
Yes, I've heard of that. So my question actually though is about the nanoparticles.
Yes,
because for me, the concern is the smaller the particle gets, the more it is absorbed.
Yes,
and potentially can pass the blood-brain barrier. So this was where one of the questions I'd love to hear your thoughts on that.
Yes.
Yes.
The binding to us, it wouldn't pass the blood-brain barrier.
Yes,
it's also to do with acidity, right? So and alkalinity. So it wouldn't pass the blood-brain barrier so much, but it's actually in relatively small amounts. And we found that, and there is a dosage to toothpaste that is ideal as well. So I often would ask these questions of the chemical engineers that actually do this. And they have studies, and one guy, he knew what I was like. He just said, oh, it's 1 gram of toothpaste. I said, what does 1 gram of toothpaste look like? Right, because not everybody is going to measure the toothpaste. So then he said it's like a large green pea size amount or 2 smaller green pea size amounts. So what I try to do with my patients, if they're not too shy, I would say to them, don't be shy about it. Bring your electric or manual toothbrush and you brush in front of me. Because I want to see how you brush. And then the second thing is that I'll correct it, but then they go, oh, why don't you just tell me how it's done? I said, I can tell you, but you need to feel it. Right? Yeah. So I just say, this is the amount of pressure. And I'll use my hand and I'll say, this is how hard I press. Because you are not pressing hard enough. I've tried this in my own mouth before. When they say, oh, don't brush too hard. Like that's a famous thing from a dentist. It's like, oh, you're brushing too hard. Well, what's too hard? You know, it's actually the wrong technique. And sometimes it's not even to do with the brushing that's caused the damage. Just by showing them once, they go, oh, okay. So I say to them, remember this feeling. And when you're brushing, you have to generate this sensation. Then you know you're brushing it right. And be systematic. You go from one side to the other.
I love that you do that, because it's similar to what I do when I have clients. I ask them to take pictures. You know, embrace your inner millennial. Take pictures of what you're eating, because it's the same thing. You need a little bit of guidance just at the beginning. But I love that you actually take the person's hand and because they have to feel it. And exactly. And then so the giving you a basic thing and you can practice this at home already. If you can get a biomimetic toothpaste, you can still do a fluoride toothpaste if you're not too bad with SLS. You know, if you don't get, I have some of even my colleagues that have gum skin peel from SLS or some kind of additive in the toothpaste. So you use your toothbrush dry, never wet it. So I think we've always been taught, wet the toothbrush, put toothpaste on, start brushing. After that, rinse very thoroughly. So that's more than 50% of it's wrong already. So first is that the brush has to be dry. You put your 1 gram of toothpaste on, brush your teeth, spit out toothpaste, you're done. No need for mouth rinsing. Nope. So the mouth rinsing part is where you reverse all the goodness. Because think about this, is that how I try to get my patients to imagine what happens in the mouth is that why we get breakdown. It's like it's an aging process with teeth, but it's very binary in the sense that at the pH of 5.5, it's very specific, your enamel liquefies. It goes from crystal to liquid. So the best way to describe it is like a block of ice. You've taken it out of the freezer and you leave it out. What happens is that it goes from that crystal structure to water, but the same molecules are still there, just at a different form. Now, what's happening in the mouth is that if, let's say, you took, and not all acids are the same. So if you have the same pH of citric acid versus a phosphoric acid, interestingly enough, citric acid causes more damage because for whatever reason, calcium doesn't bind back onto your teeth when you have citric acid. So interestingly enough, drinking orange juice is worse for your teeth than Coca-Cola, right? If it's the same pH. But it's not. So that's only when we're looking at just the teeth. We're not talking about the microbiome.
Exactly. Just the teeth. Just the teeth. So when I speak to them about this is that I said, take everything else out. I'm just looking at your crystal structure here at pH of 5.5. So let's say, and I know this for sure, let's say you drink a Coca-Cola. The Coca-Cola is a pH of 2.8, very, very low. Wine is at 3.5, right? So you have 2.8 pH it is decimating your tooth.
Yeah.
Right? So it's like taking the block of ice and putting it in a furnace.
Yes.
Right? Now, if you drank the Coca-Cola, and now I'm not talking about any of the problems to your gut, because let's say you drank it fast. Yes. I mean, it's very bad, but you drank it, and then you get the double whammy. Now, so some say, oh, yes, but I'm drinking Diet Coke. No, it's as bad.
Exactly.
And it's as bad to your metabolism. But let's say you have that. It really is about the time it spends in the mouth that causes the breakdown. So if you drank that, let's say, or let's say you take lemon water, and it's perhaps good for the system. So I think it's a natural diuretic, if I'm not wrong. So some of my patients who have seen nutritionists take the lemon water, and I suggest to them not to take lemon water throughout the whole day.
Correct. Yes.
Yeah, just one time.
Correct.
And then very quickly afterwards, swish water in the mouth, and you can drink the water, but you neutralize the acid.
Yes, exactly.
Right? And then you get the benefits, but you don't have the damage from the teeth because it's time related.
Yes.
So same thing is that when you brush your teeth with fluoride toothpaste, and if you actually reach 2 minutes, most people don't, of brushing your teeth with the fluoride toothpaste, and you rinse it out, the fluoride does almost nothing.
Right.
Because the fluoride or any kind of remineralizing agent, so if you have hydroxyapatite, if you have that on your tooth surface, it has to remain there, like moisturizer. I mean, do you put moisturizer on your skin and then immediately wash your hands?
Yes. Yeah.
If you do that, effect is zero.
Yeah.
So let's say you're a person that eats just a regular diet. So I remind patients that it doesn't matter whether it's unhealthy or healthy, the acid will do the same damage in the mouth. So if you ate a tomato, which is acidic, versus something else that is less acidic, but it can cause different kind of problems in the mouth, you are still going to get as much damage with the healthy thing as the unhealthy thing.
That's where I would slightly disagree with you on, not from a dental perspective.
Yeah, sure.
But
definitely.
Yes, because I think, having the tomato versus something else like a candy or sour candy.
Yes, for sure.
Right? Where if we're just looking at the mouth, so in functional practice, it's about looking at the whole system.
Oh, yes, absolutely. Yes.
Because then sometimes people say, oh, my dentist said a tomato is just as bad as the...
Because why I bring that up is only when they go to me, oh, doctor, I eat healthy things.
Yes, yeah.
So I look in their mouth and I see this damage. And so the questions I would ask them is, the first thing I ask is, what do you eat? And they get very defensive. They go, I'm healthy. I said, okay, let me just break it down. Because I used to say, do you take soft drink? And they go, no. Do you take juice? Oh, yes. I said, that's a soft drink, right? So then they go, I thought you meant the unhealthy drinks. I said, no. Yes. So then now I'm very specific. Yes. So I go, do you drink orange juice? So, okay, if you drink juices, is it a cold pressed juice? Like what kind of juice is it? Is it a citric juice or, is it papaya? Is it something else? And then I just note it down only because sometimes we don't see the issue being that, but it could be something else, but it could be a combination of things. And then it's usually when I go, the tomato is the very big thing. So I would say, okay, I can see that you're very healthy because they look like they have no inflammation.
Yes.
Right? They're very fit and healthy. They are often, so I treat a lot of athletes as well. So athletes tend to have the most worn teeth.
Yes.
Because of the citric acid sometimes they have with their isotonic drinks. The second thing is that they are chronically dehydrated.
Correct.
Yeah.
Yes. Yeah.
So
overtraining as well.
Exactly. Overtraining. And overtraining is a massive stress to the system.
Yeah.
And I think Peter Attia talks about it, and they found that cholesterol levels, triglyceride levels actually go up in athletes. Yeah.
Well, so the thing is that you can't out-exercise high cholesterol.
No. That's
true. What a lot of people don't realize.
Yes.
And I respect Peter Attia in so many ways. He's elevated the health conversation.
Yes.
Where I wish the conversation would just end a little or get in is bring in a nutritionist to talk about the food.
Yes, exactly. More nutrition.
A little bit more of a,
Yes.
so a lot of doctors, we all know what is healthy, but they haven't actually studied it.
No,
So this is where
exactly.
even with Peter Attia, who is fabulous in conversation, there's a little bit where
There's
I'm
a
like,
limit.
yes,
Yeah.
there's a limit, when you're talking about, he wears a, continuous glucose monitor. And
Oh, yes.
because he also is struggling with his own glucose. So it's funny. And I think, glucose balance is one of the fundamental first things that you have to address in functional practice.
Absolutely.
So sometimes I wish he would be a little bit more cautious on that kind of conversation.
Right.
But yes, with cholesterol also, and you were talking about, when you ask people what kind of medications you're on, if you are on a statin, for example, and you are blocking your cholesterol synthesis, you're not just blocking cholesterol, you're also blocking cholesterol's downstream products.
That's right.
One of those being vitamin D. And vitamin D is hugely important to oral health. And just
Absolutely.
human health.
Yes.
So
Yep.
I think those are really great questions that you ask all your patients, and the fact that you ask them what they eat. But yes, I think there is that nuance of, when you're having a lemon water, you don't want to be sipping on it all day, but you do want that, you want to hydrate with that,
Yes.
and it
Okay.
is a great source. And when we consume lemon, it's acidic at the start, but the end product
It's
is
alkalizing.
alkaline.
Yes.
So yeah, this is where,
Exactly.
but if we're sipping it all day long, we're only getting the starting product on our teeth. We don't want that either.
No.
So yeah,
Exactly. So it's just to counteract the damage that might occur in the mouth.
Rinse with
but
water.
everything else is good, right?
Exactly.
So yes, to your point as well. Oh, okay. So I think this will be a good segue into the lemon, and how I think this is the biggest misconception that a lot of patients have about what is acidic, and is it acidifying, right? And alkalizing
Yes.
versus acidic and alkaline.
Yes. Yeah. Well,
So,
this
yeah.
is exactly what what I briefly touched upon earlier about,
Yes.
amino acids. So protein.
Yes.
Protein is a building block. Amino acids are building block. Protein's just a big chain of those.
Yes.
Right. But amino acids, if you think about the kind of the origin or the etymology of the word, amino acids derive from the Latin word for ammonia. It's a derivative of ammonia, meaning there's a nitrogen there.
Yes.
Right.
Right.
It's because we have carbons, hydrogens, oxygens, and nitrogen. That's the differentiating factor in an amino acid. But this ammonia, or this amino acid, when we break it down, turns into ammonia. And ammonia is actually alkaline. But when it comes into contact in our blood with carbon dioxide, it creates carbamyl phosphate. This is very acidic. And this is acidifying to the blood. And this is what has to go through our liver and has to go through our kidneys. So it's funny because, when we look at kind of the acidity of a food, we only really look at that for people who are in chronic kidney disease. That's where you start to measure very carefully what you call your protein renal acid load, your PRAL. But for normal healthy people, we don't look at that. So it kind of reminds me of when my son, it was that 9 days of constipation is fine. So we're going to wait till then. We constantly pushing protein and amino acids all the time. But then, you have people, and I see people who are in their mid-30s who have very low kidney function, and they've been on this crazy high protein diet. And you're thinking, well, all of a sudden, this kidney disease that is probably for 70 and 80-year-olds, you're now seeing it in 20 and 30-year-olds. So I think this is where we just have to look at food and let people and explain to people the whole trajectory of how food starts and how food ends. And I'm not saying, protein is very important, and amino acids are very important, but I think we have to be careful about the sources,
For sure.
and the quantity. They always, people say, what is it? Dosage makes the poison, or
Yes, for sure.
So
Yes.
it's kind of looking at that, and especially when you overlay that with someone who has high cholesterol or hypertension. And they're like, oh, well, I've been on a keto diet and I'm losing weight, but their numbers still aren't changing.
Yes.
Then because you have to understand the byproduct, the end product.
Yes. It's very interesting because actually, in the Chinese culture, there's this thing about heatiness and cooling, right?
Yes. Yeah.
And I discovered it by myself, but I think it's people have already understood this for a while. Is that there's exothermic and endothermic reactions in the body,
and functional would say anti-inflammatory and
yes,
pro-inflammatory,
and acidic and alkaline,
yes,
right? So the this acidity increases actually causes more exothermic reactions, right?
Yes.
And that is what causes the heatiness,
Exactly,
right? It's the increase of heat.
And pathogens and viral load
oh, yes,
thrive in acidic environments.
Absolutely.
So and I love that you mentioned, in the Chinese culture because also kind of this idea that exothermic, endothermic, heaty and cooly, it's kind of that yin yang principle.
Yes.
Right.
Yeah.
And I think we have to recognize that if we have something and we think, it's going to be great, there's always going to be a side effect, or this medication is really effective, but what are the side effects? And so you have to always think about the balance.
For sure.
And
yes,
I think
yes.
I know in functional practice, it's about regaining balance and finding that homeostasis that our body likes to naturally be in.
So when you, going back to your kids, so when you went through this journey, when your kids were quite young, when did you make that transition? Was it while they were very young that you went from... So you were working in finance before?
Yeah, I was in finance. I was in finance before and in journalism. So I did about 5 years in finance, 5 years in journalism.
Oh.
And then a little bit of financial journalism.
Right. Okay.
But then, when my kids, it was, I guess I'm someone who likes to figure out the root cause, and I love to learn. So for me, when I saw my kids change just by changing the food that they were eating, the ear infections went away, the runny nose went away.
Yes.
At night, the sleeping was a lot quieter. Within a very short window, I thought, wow, this is something that it blew my mind.
Yeah.
And I thought, I want to learn more about this. So then it was another 5 years of studying again. And, so that was, luckily they were still young at the time.
Did your daughter end up doing those procedures?
No, she hasn't. No antibiotics, no operations.
No operations.
And we just are aware that certain foods are more pro-inflammatory. So we try to avoid those foods.
Yes.
But I think what a lot of people don't realize is that, even as children, yes, they heal quickly, but they have a unique microbiome as well.
They do.
And that microbiome starts to settle around age 3. So really, it's those early years that really actually are very important on what you feed your kids.
Yes.
And which direction you want that microbiome to go to. And like you said, you can see from their teeth how they were born and what it was traumatic. It's amazing the signals that the body shares. And I like to tell people it's often that you have to listen to the whispers that your body gives. And the whispering is always before the screaming. So if you can catch it when it's whispering, it's a lot easier to prevent the scream.
Yes, exactly. And funny thing is, you may or may not know this, but I often would see patients that get very acute inflammatory issues in the gums. And when they come in and they go, oh, doc, I out of the blue, I got this inflammation in the gum. And 2 questions I would ask very quickly. One is, have you been sleeping well? And 2, have you been unwell recently? And usually it's one or both that has occurred. And I said, it's not right now. It would have been about 1 to 2 weeks ago. And they go, oh, how did you know? Like I had a cold a week ago. I said, it usually follows. Because, I theorize it as such where when your inflammatory processes are at its heights, usually it peaks only after the disease. So now in medicine, we understand that bacteria or the triggers of a disease or virus, let's say, or a bacteria, is a trigger for the immune or inflammatory system to recognize that there's a threat. And basically there's a cold war and then outright war. And then after the outright war, there is a recovery period where everybody is just a little bit paranoid.
Yeah.
So your inflammatory system is not going to leave the war site until it knows it's completely safe. So anything can trigger off an inflammatory response, and then the gums just they'll fluff up.
Yeah.
And it's because of the residual inflammation that they're going through. And I say, well, you just wait for a few days and we keep it clean. And we see it in pregnant women too. So and we see it in kids who are going through school where they're going to have exams soon. We even had this thing called one's called pregnancy apulus, so that when the gum swells up very acutely, and the other one's called exam apulus. And interestingly enough, when I was studying about gum disease like this, I got exam apulus.
Yeah.
So if all of a sudden you get like a puffy gum, and that's to do with that. It's just that your body just responds to plaque in a different way, more exaggerated way. Your gums are throwing a tantrum.
Yeah, well, you have the bacteria or the virus present, and then on top of that, you add exam stress, cortisol, right?
Exactly. Yes.
And stress is perceived, but it becomes very chemical, and cortisol is that trigger for all those inflammatory cytokines. So I think there's so much overlap in being able to see it in the mouth. And I mean, I look at it from a kind of a labs and a gut microbiome perspective, but there's so much overlap. And it would be, I wish all dentists could be like you.
Because actually this came by accident, but I had a patient that just had refractory gum disease. What that really means is that it just did not respond to any kind of treatment that we were doing. And so we went really deep for this person, and I spent hours and hours just trying to figure out what was wrong. Why is it? So my question is always that the scientific mind would go, if it's directly causative, if it's just this bacteria or this problem that's happening, then shouldn't it be solved by the exact thing that will fix the cause, right? And so what are the other factors that is contributing to this disease that is different to this person compared to everybody else? So then, the perfect example of how stress and diet really relates to even just plaque in the mouth. So I had this one patient. He was director of a company. I've been seeing him for years, and I've constantly been nagging at him, like, you need to brush better. And he kept saying to me, Doc, I'm doing the best I can. But I said, I see you every 6 months and you have like tons of plaque on your teeth. What's happening? And he goes, Doc, I'm really doing the best I can. And then I didn't see him for another 6 months, and he came in and his teeth were immaculate. The gums were so healthy. Usually as soon as I touched the gum with my instrument, it would start profusely bleeding. And I said, oh, finally, right? You've done it. And he said to me, Doc, I've been doing the exact same thing. No difference to my brushing. And I said, well, something's very different. So that was the very first time when I started to get aware of everything else. So I sat with him and I said, this is like night and day difference. There's something different. Okay.
What was it?
Tell me about your life. He goes, okay, my wife made me go on a sugar-free diet.
Oh, yes.
And I said, how long have you been on it? 6 months. Okay. What else? Then he goes, oh, I've been on a sabbatical. How long? 6 months. Okay.
Less stress.
So stress is gone. Sugar's gone. So no inflammation, nothing. He looked great. Then he stopped. He says, I'm stopping the sugar thing. So I'm slowly reintroducing sugar. Saw him 6 months later. And I said, still pretty good. Not bad. He goes, I've been having sugar and I'm brushing the same way. I said, still on a sabbatical? Yes. Okay. 6 months later, saw him again. Back to the bad stuff.
Oh,
And I said, what's happened? He goes, I'm back at work.
Oh, yes.
Right? So The stress was major because and what I see with stress is that because it affects the sympathetic system, right?
Yeah.
Their saliva flow is highly affected.
Yes.
So it's like, and I can see it in the mouth. So as soon as he opens his mouth, I can tell that his mouth is bone dry.
Yes. Yeah.
And he's just in constant chronic
stress.
dehydration, from the stress.
Yeah.
And he doesn't know it because that's his norm, right?
Actually, in women who are menopausal, that's also actually, or even perimenopausal, that starts to be a symptom as well, the dry mouth.
Right, yes. Yeah. And I see that too. Yeah, so a lot of perimenopausal women.
But the stress, I think it's important to say we have to recognize stress and distress. And I think we obviously know distress is bad, but there can be healthy levels of stress.
Oh, yes, for sure.
But I think when someone is a director of a company and their work is just at that higher level of stress, they have to recognize, okay, this can't change. I now need to think about what are my other stressors.
That's right, yes.
And food is often a big stressor for people. Yes. So if you have work stress that's up here, you have to make sure then you're getting your food really right.
Yes.
Whereas I think people who, if you're on holiday and you're relaxed and you're not in a stress, you can kind of be a little bit more relaxed on the food side of things. But I think you always have to balance out where is that stress coming from.
Yes.
And usually it's work, food, and then that lack of sleep.
Yes.
Yeah.
So in your work, let's say if we want to be very specific with the, have you read Stephen Lin's book, Dental Diet?
No.
No. Okay. So there's this book called Dental Diet. Quite interesting. A lot of people would have thought it's very woo-woo, right? But that's how people look at nutrition anyway, and which is sad.
Hopefully that's changing.
Yeah, hopefully that's changing. So again, when this came up, I read his book, and I think he did it through his own volition as well. Like you, he was just seeing these concerns and issues, and he likes to cook, and he has recipes and all that in there. But the dental diet is basically a good diet, right? So, but very specifically in your experience, what would be, if someone has a lot of gum inflammation, what would you say be a baseline thing that they should start looking at? As far as nutrients and vitamins are concerned, we talked about vitamin D, and that is an issue. I find when I'm dealing with patients who have a lot of stress and they have a lot of clenching, grinding issues, I ask them to take quite a bit of magnesium, and that helps sometimes even better than Botox does. But have you come across concerns and issues like that?
With people who I work with, and they have a lot of stress and that clenching. It's the physical food stress that I'll probably start is just by asking what they normally eat, trying to understand, because what I don't want to do is prescribe a meal plan that is unrealistic.
Yes.
So what I try to do is figure out, okay, well, what's your normal like?
Yes.
And then we try to make a couple of changes just to start,
Yeah.
one or two.
Yes.
When I know those are, those have become habitual, then we start to add on a couple more changes over time. Because if you're going to overhaul someone's diet completely in one day, it's very rare that someone will actually stick to it.
True.
So what I'm normally looking at with someone who has kind of weak gums or gum disease or something, I think it's looking at gums are made out of collagen, right?
Yes.
And collagen is, one of the most abundant proteins in our body. But the strength of that collagen really relies on vitamin C. So we're looking at not supplements, oral supplements, but I'm looking at fresh, real sources of vitamin C, where it has kind of the active metabolites.
Right.
So we'll try and, put a couple, find more sources. And I'm a big fan of, I think juice is the wrong word, but a green vegetable liquid. So, juice, a lot of people associate with fruits and fruit sugars. But green vegetable liquid.
Yes.
That is also a great source of, fresh vitamin C. Your broccoli has vitamin C. All of these, not just your citrus fruits, but your greens have it. The greens also have a lot of magnesium. So like you said, magnesium is a great relaxer. So that's sort of one of the foods I will try to incorporate early on.
Yes.
Because I just see such a host of benefits across the board, whether it's cholesterol, whether it's gum health, whether it's better skin. This is something that feeds our microbiome. Our microbiome loves that sort of soluble fiber, and when they receive that, they can start creating these products, these short chain fatty acids. It's like a positive signal sent to your immune system. It's almost like saying, hey, let me just regulate the immune system. Don't get worked up, just stay calm. And so it brings the whole body, down to a level where it's not so reactive. So this is actually one of the first things that I'll suggest. And usually in the first couple weeks, people start to say, oh, it's not so bad. And it becomes a habit. And then that's when I know that they're ready for the next steps.
Right. Yes. Yeah. So, it's often good that way, gradually, right? Yes.
Yeah.
And you don't have to get it right immediately as well.
Yeah.
So incremental.
Yeah, exactly. Yes. It's very rare where I have someone who overhaul my entire diet. I will follow you to, every single, there are a couple people like that, like the gentleman who's lost, 9 centimeters.
Yes.
He's one of those people, but very, very rare.
Yes.
So I think it's about those small changes that you can make every day. And I try to remind people health and disease are on a sliding scale. It's not that, we're so healthy for, 24 hours and then, we can be unhealthy for 100 hours. It's that you're always constantly moving. And I guess it's kind of the idea of also like you can't, when people say, oh, I need to make sure I catch up on my sleep, you can't just sleep for like 50 hours and then not sleep for
that's right.
You've got to have consistency and regular sleep. So I think that's one of the key underlying principles in having nutrition work for you. And I guess same thing in dentistry. It's that daily 2 minutes of brushing. It's the flossing. For it's just that daily intake of soluble fiber. Those little staying hydrated. It's
and I remind them it's what they do every day is more important than what I do every 180 days.
Yes, exactly.
Right?
Yes, yeah. I mean, we'd love to always come in for a dental cleaning every day. I mean, I always find my teeth feel amazing afterwards. But you're right, we're not going to do this every single day.
No.
Right?
Yes. So. If only we could. Yes. So, was there anything else that you'd like to touch upon, or anything you'd want to ask?
No, I think we've had a really great conversation. But I'd love just to remind your listeners that listen to the whispers. If you have a toothache, if you are starting to notice your mouth is a bit drier, or you have a bit of sensitivity, that's a whisper that your body is trying to say, hey, there's some sort of inflammation. Check with your dentist, go and treat it. But also let's think about let's go back. Why is my mouth a bit drier, or why is my gum a little bit softer, or why it's bleeding, and try and understand the role that food really plays. Because again, any microbiome is an ecosystem, and that ecosystem has to rely on substrates coming in, and it has products that it creates.
Yes. Actually, before we end, I quite a couple of years ago, I was reading about this procedure called fecal transplant.
Oh, yes, FMT.
Yes.
Yeah.
And I was going, wouldn't it be wonderful if you can just go, I want to look like that person. Obviously, this person doesn't have any inflammation. I'm just going to fecal transplant. from that person and then just get all their microbiome. But obviously that doesn't quite work because it doesn't necessarily gel with your own genetics, right? But
no, the FMT is really interesting, and I think that's it's a potential therapy. And I think right now it's still early stages, and it's being trialed on children with autism or elderly with Parkinson's, and so you're looking at it for very specific disease states. But the idea is that I find it funny is rather than changing your diet so that you can change your own microbiome, people would rather swallow someone else's feces, right? Or have it implanted. Because changing the diet is really
it's very
tough.
difficult.
It's very difficult.
Yeah, it's so taste related too.
It is. But that I think the FMT really reminds us that the microbiome is adaptable. But it's not that we can just have FMT orally or the other way around. But again, those benefits, you'll see them, but in order to have the longevity of the benefit, you need everyday stable consistency. You have to feed and nurture that microbiome.
Yes. My wife thinks I have no stop limits to my eating. So I used to be very skinny. And so and my metabolism is very, very high for good and bad reasons. But I used to be on a 10,000 calorie per day diet when I was an athlete. And sometimes I eat the same way as I used to. Which is tons of chicken, a whole pan of lasagna, and just keep going and going and going.
We will have a conversation offline then about cholesterol and blood pressure and all of the microbiome.
What I all have.
Yeah.
I think my microbiome is now controlling me and my appetite. So thank you for listening, and thank you, Jieun, for coming in. This was so useful.
Thanks for this conversation.
Thank you all.